Zolpidem is one of the medication which is used to treat insomnia. It is called Z hypnotic as it is starting with the letter Z. It is particularly used to induce the sleep in people who are having difficulty sleeping. Zolpidem is available as tablets as well as capsules, and this medication just acts like benzodiazepines. However, before using this medication, you should know important facts like when it should be used and what are the important effects of this medication on your attention and daytime activities. So today in this video, we are going to discuss all such key facts about this medication. Now let us the important precautions of this medication. When this medication is used, it can produce some impairment of attention on the next day. Since this medication induces the sleep, the sedative effects may be present on the following day. Therefore, people may have less attention and they may have decreased ability to concentrate the things. Especially, this medication works better in the people who are having the sleep time of at least 7 to 8 hours. That's why it is always recommended to be taken before the bedtime, and when it is taken without sufficient sleeping time, it may produce next day drowsiness and sedation. Particularly, this drowsiness can be further increased when Zolpidem is taken with other CNS depressants. Many of the medications like benzodiazepines, which are used to control anxiety as well as to induce the sleep, and medications like opioids, which are used to control the pain, which are centrally acting. Few medications like tricyclic antidepressants can also be given to control the depression or even to control neuronal pain. All these medications can produce CNS depression, so when they are combined with Zolpidem, they can produce significant CNS depression. This may result in high sedation, drowsiness, dizziness, and confusion. Intake of alcohol can also affect the actions of Zolpidem. That's why it is better to avoid the intake of alcohol while taking Zolpidem. When Zolpidem is taken at the doses about 10 mg, it can produce some respiratory depression. This may produce sleep apnea, reduced respiratory function during the sleep. When this medication is going to be taken, it can alter your attention, particularly on the next day. You may have significant drowsiness and dizziness. That's why it is always better to take high precautions while driving the vehicles or working with machinery, as this medication can produce dizziness, sleepiness, blurred vision, and drowsiness. You may also have double vision and reduced alertness, which may increase the risk of injuries or accidents. That's why you have to maintain a full night of sleep. At least 7 to 8 hours are required after taking this medication, and this is more important when you are going to take extended release dosage forms. The effect of drowsiness and reduced alertness is more troublesome in the women compared with men. That's why in the women, the dose of this medication is limited to avoid unexpected drowsiness. Just like many other drugs, this medication can also produce angioedema as well as anaphylaxis. It may produce some swelling of tongue, face, or larynx. In such conditions, this medication should not be used even in the future. Another important aspect of this medication is the induction of abnormal thinking and behavior. It may induce hallucinations or even sleep driving. Particularly, this is more observed when Zolpidem is combined with other CNS depressants or co-administered with alcohol. That's why alcohol should be avoided while taking Zolpidem. When this medication is suddenly stopped, it can produce some withdrawal symptoms. Therefore, rapid dose reduction or discontinuation is not recommended, as it may produce insomnia, irritation, and anxiety. In people with hepatic insufficiency, this Zolpidem should be carefully used, as it can precipitate hepatic encephalopathy. That's why before using this medication, any hepatic dysfunction should be carefully checked. Now let us see the side effects of this medication. Since it acts on the CNS, it mainly produces dizziness, drowsiness, headache, and sedation. It can also produce hallucinations. Few people may have muscle pains, sinusitis, and visual disturbances. It can also impair the memory, leading to loss of memory. Constipation, palpitations, or few other side effects observed with this medication. How it is given? Zolpidem is available as tablet in 2 dosage forms. It is available as immediate release tablets as well as extended release tablets. Immediate release tablets are available at strengths such as 5 mg and 10 mg, whereas extended release tablets are available at a strength of 6.25 mg and 12.5 mg. This medication is also available as a sublingual tablet, which is intended for treatment of midnight insomnia. For this purpose, it is available at different strengths starting from 1.75 mg to 10 mg. Even this medication is available as a capsule at a strength of 7.5 mg. For the treatment of insomnia, the dose of this medication may be different in the men as well as in the women. Particularly, the maximum dose is limited in the women to avoid CNS depressive effects. In case of immediate release or sublingual tablets, Zolpidem can be given at a dose of 5 mg initially, both in the men as well as in the women. However, based on the response, the dose may be increased to 10 mg only in the men whenever required. In case of extended release tablets, it can be started at 6.25 mg both in the men as well as in the women. However, this is the maximum dose in the women, whereas men can have 12.5 mg dose if required. Always the lowest effective dose should be started, and it should be taken immediately before the bedtime with at least 7 to 8 hour gap before the time of awakening. The dose of Zolpidem should not be increased above 10 mg, which increase the risk of severe drowsiness and reduced alertness. For treatment of midnight insomnia, Zolpidem can be given as a sublingual tablet at a dose of 1.75 mg in the women and 3.5 mg in the men. How this medication works? Zolpidem acts just like the benzodiazepines. It increases the activity of the GABA. However, it is going to bind to a different sites on the GABA-A receptors. By binding to the GABA-A receptors, it promotes the binding of GABA to the GABA-A binding site. This opens inward-going chloride channels, which produces hyperpolarization. Because of hyperpolarization, negative potential is going to be produced, which reduces the activity of neurons in the brain. This induces sleep in the people. In this way, Zolpidem just acts like benzodiazepines. So that's all about this medication, Zolpidem. I hope this video is useful to you. If you really like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thanks for watching. See you in the next video.